and welcome to Advanced Mattapan. Today's issue, health disparities. Too obvious to be denied? Health equity. Is it a matter of race, place, or just another case of shifting paradigms? Today's guest, Nishira Burrell, Boston Public Health Commission's co-director for the Center for Health Equity and Social Justice. Welcome, Nishira.
Thank you. Thanks for having me.
Tell us a little bit about the Center for Health Equity.
Sure. So the Center for Health Equity is in the Commissioner's Office at the Public Health Commission and works both internally within the Commission as well as externally with coalitions, community partners, and grantees across, in fact, southern New England to address the social determinants of health, social factors that lead to those disparities and inequities that you mentioned, and really trying to address those using policy systems and working with individuals.
Now, you mentioned something, social determinants of health.
Yes.
Are we talking about genes, behavior, and choices? What are we talking about?
In some ways, the social determinants of health are those things that influence our health. And often when we talk about those, we're meaning these social, environmental, economic factors that influence our health. So things like education, transportation, housing, access to food. Those are things that sometimes we don't always think about as having an influence on our health, but as you mentioned, place does matter. And so those social factors have a lot to do with our health and determining our health status.
Interesting.
When we think about health, oftentimes we're thinking about, chronic diseases or health outcomes. And I think traditionally for a long time our approach in public health and certainly in healthcare has been working on the individual level, and so treating somebody who has diabetes or another chronic disease. And when we take a social determinants approach, as we often refer to it, is thinking about those things beyond their behavior or their genetics. We're really thinking about the environment that shapes people's health. So it's not just about when you get to the hospital, but it's about where you live, work, where you grew up, where you play. All of those things influence health. So for example, housing. When we think about housing, the quality of housing, whether it's safe, whether it has clean air, or there are asthma triggers, cockroach allergens and dust, and all of these things can contribute to asthma. And so when we see higher rates of asthma on a population scale from one neighborhood to the other, it forces us to think not just about what's going on in a particular household, but what's happening on a larger scale, on a community level, population level.
Okay, so it sounds like what you're saying is that environmental factors contribute a great deal, or more so than we would typically think.
For a long time, I think the messages have been to take care of yourself. And if you're overweight or diabetic or your kids have asthma, it's something that you need to maintain and you need to manage. And what we're trying to say with this approach, thinking about those social factors, is really giving weight to those things that are outside of an individual's control. The food environment, whether or not you live in a community that has access to healthy, fresh produce, a community that has green space for exercise. So I can tell you all day long that you need to exercise and eat healthy, but if you don't live in an environment that supports that type of behavior, it's going to make it much harder for you to do that. So this movement, this health equity movement, is really about addressing place and thinking about how do we ensure that everyone has an equal opportunity for optimal health. And place really does matter when it comes to our health.
There was this new initiative that the Health Commission was forwarding. I think it was called What's Your Health Code?
Yeah.
Tell us a little bit about that.
It was our attempt to kind of raise awareness of this concept that place matters and challenge some of, I think, what is the dominant frame or the ideology that health is all about individual behavior. So we tried to challenge that by really identifying Boston as a city of neighborhoods and saying that place does matter, and if you live here and if you live here, these are some of the factors that might influence the health of that community. So what we did is we had billboards all across the city, and if you'll remember, they were of the zip code of that neighborhood, and it was really to kind of have this experience for residents as we travel through the city, as we go to work, as we go to visit our sister, visit our mother, go grocery shopping, kind of traverse the city, that we would be experiencing the lines of our neighborhoods. And it was really to drive, there was a tagline, what's your health code? And the idea was to drive folks to a very experiential website where you could fly around the city of Boston in what was a wonderfully kind of watercolor 3D version of the city and read a little tidbit about the factors in that particular neighborhood that influence health. It was a challenge. You can't say everything, and every neighborhood has assets and challenges, but we tried to pick a little highlight in each community to really talk about one community having a challenge around housing or around access to food or green space or income. and those assets, but also those challenges and what that can mean for each neighborhood.
We welcome now Javier Gutierrez. Welcome.
Thank you.
You are with a particular initiative that the Boston Public Health Commission has introduced. Relate some of what Nashir's been talking about in terms of place matters to a couple of specific neighborhoods in Boston. Tell us a little bit more about what you've been working on.
Well, we've been working on this campaign called the Healthy on the Block Project. Pretty much the Healthy on the Block Project is actually, it's underneath the umbrella of the Strategic Alliance for Health. The Strategic Alliance for Health is a 4-year initiative funded by the CDC, the Center for Disease and Control, with this emphasis on promoting and building capacity on nutrition and physical activity, and also eliminating ethnic and health disparities across certain communities, working specifically in 2 types of sectors, school sector and community sector. And the Healthy on the Block project focuses on the community sector. And the Healthy on the Block project, it's an initiative working in East Boston and in Mattapan to bring healthier food options into these communities, such as fresh fruits and vegetables, and whole grain consumptions. Working closely with corner stores in these both communities, specifically Mattapan and East Boston.
Why corner stores?
Why corner stores? As you know, East Boston and Mattapan, they're in different parts of the city of Boston, but they share something similar. Combined, there's in East Boston, you're looking at a population of approximately 40,000 people. In Mattapan, you're looking at a population of 38,000 people. In East Boston, there's only one supermarket. In Mattapan, there's none. But however, there are these small stores, corner stores that they're called, sometimes they're called bodegas, and that's where people come and eat. Unfortunately, these stores do not have the capacity, or there's not the demand for people to come in and buy produce, for people to come in and buy their whole grains or whole wheat or whole bread. And that's where we come in terms of working with them and building that capacity, and at the same time working with the community to create a demand for those stores. And where it comes into play is you're looking at East Boston as the highest, as a high immigrant population. And you're looking at Mattapan across the 16 official neighborhoods in Boston is the high rate minority people live there. The majority of Haitians live in Mattapan, and also blacks live in Mattapan.
Okay.
With going over both communities suffering from high rates of obesity and diabetes that really is affecting our communities, affecting our children, our grandparents. That the best measure for inviting them to join us evolve around a couple questions. Really, their involvement in the community, their willingness to have community members come into the store and work with them. That's in product placement, shelf labeling, cleaning the store, or just talking to their customers. Their knowledge about the community itself, and their interest in joining the Healthy on the Block project. And we did this because we realized that just by talking to them, really this was kind of a new idea for them. Nobody really came to talk to them, share that information, share the stories, and really brought it home and really made them see. And it's really the truth. They are the backbone of the community.
To welcome now to the show, Cassandra Cato-Lewis, who is the coordinator of the Corner Store Initiative in Mattapan for Mattapan Food and Fitness Coalition. Cassandra, welcome.
Thank you. Glad to be here.
So what do you want people to know about the Corner Store Initiative in Mattapan? Anything?
Yeah, we want them to know that it's happening, and if the corner store that they are close to is not Mama's or Lily's, that they start talking to their corner store owner, asking them how they can start bringing in more fresh produce and if they might want to join our initiative. They can also join our volunteer group in helping to outreach to more community members and corner store owners. We always can use people to help either plan events, to man the events, to do outreach and organizing, and we're trying to get into more communities because, as you know, Mattapan is a large area, and right now we're only on Blue Hill Ave.
Okay.
Well, we want them to know that they have power, and their power is not only in their personal actions, as Nashira talked about, and not only in their place, but in their pockets. So if they begin to buy a few things at the corner stores, if they begin to ask for healthy options, whole grain pastas and cereals and things, then the corner store owners will see that there is a market for it, and they'll start bringing things in.